Hey guys, it's Dave. Today we're going to talk about celiac disease or celiac sprue or gluten enteropathy or gluten intolerance. All of those, same thing. It's an autoimmune disorder first and foremost, which means your body is actually recognizing something that normally is not foreign as foreign and wreaking havoc with you. It's triggered by, of course, gluten. So what is gluten? It's a protein found in grains, specifically wheat, barley, rye, and some other ones as well. They're like crossbred grains out there that actually provides no essential nutrients. So removing it does not hurt your diet one bit as far as that goes, because it's not giving you anything that you actually need. Unfortunately, gluten is found in a lot of things. Foods, drinks, but not only foods and drinks, but soaps, cosmetics, chapsticks, as well as shampoo as well. What happens in celiac disease is your body responds to gluten by causing damage to the villi in the intestine. The intestine has villi surrounded, kind of looks like a little centipede around the whole entire small intestine. And what they're responsible for is actually to absorb nutrients. And the absorption of the nutrients is so important because that's the spot that the body is getting all of its energy from, and all of the good things that your body needs is through the villi. So as the food passes through the GI tract, if the villi is not doing what it should, you're not absorbing everything that you need, and your body will suffer for that. Eventually, because of the chronic poor absorption, you can see things like anemia, osteoporosis, even dental issues because your teeth are not able to get the calcium and nutrients they need as well, so you could have teeth that are falling out. Neuropathies, as you get tingling in your fingers and in your toes as well. Anxiety, depression. Of course, you'll see things like bloating, gas, diarrhea, weight loss due to the malnutrition, so not a good thing. You're going to be more prone to things like liver disease and stomach cancer as well. In kids, because it's not just adults, you can see this in children. You will be prone to seeing stunted growth, where they're not going to grow to their full potential because they're not getting the protein, they're not getting the nutrients that their body needs to go through growth spurts to get them where they normally would be. As far as risk factors, the main risk factor is genetics. If you have a family member that has celiac disease, you're going to be at risk for it. So really pay attention to what's going on in your family as well. If you are white of European descent, you're going to be more prone to it. Type 1 diabetics have a propensity to getting celiac disease. Down syndrome patients and other autoimmune diseases. So if you have rheumatoid arthritis, if you have Crohn's disease, you're going to be more prone to getting celiac disease as well. As far as symptoms, and this is very important to pay attention to this because this disease is one you do not want to self-diagnose. But symptoms would include gas, bloating, diarrhea, or constipation, cramping, fatigue, weight loss of unknown origin, meaning you're not trying to lose weight, but by gosh, it's coming off. Foul smelling stools that are generally pale white or have like fatty tissue on them as well. Decreases in appetite. And then the other thing that can be a telltale with this one, because of the autoimmune aspect of it, some people will develop a rash on their body as well with that. So if you see any of these, you need to talk to your provider before self-diagnosing. Because I know there are those out there that have this and they go, oh, I'm just going to eliminate gluten and go with that. But other disease states and other conditions can cause a lot of these same symptoms. So it's very important you go to your provider and find out for sure, because they will run blood tests or they may do a biopsy that can be affected by any change that you make in your diet, such as cutting out the gluten. So if you cut out the gluten and go in, it may give a false negative when this is really what you have. The good news about this disease is you can live a long and normal life with this. You just have to watch out what you're doing and taking in. Beyond Celiac is actually a company that helps people with celiac disease, and I got a lot of information from them. The main treatment is avoid gluten, even a little bit. And this is one thing that they said is there's a big misconception that, you know what, a little gluten I can deal with, but a little gluten for you may be basically life-altering in the fact of how it wrecks your gut compared to somebody else. But the best treatment is avoiding gluten, period. So a little gluten can still have big effects. And gluten-free is actually less than 20 parts per million of gluten and considered safe. So if you see gluten-free, there may be a little gluten in there, but per the FDA, if it says gluten-free, you are generally considered safe with that. In cosmetics, and again, this is information from Beyond Celiac, that's more of a personal choice. You don't have to get rid of all cosmetics, shampoos, and soaps that have gluten in it. But the ones that they do recommend you removing are lipsticks, chapsticks, and hand lotions where there could be some contact in your mouth that you may potentially ingest and therefore causing a gluten flare-up with this. So you don't have to get rid of everything, but those are some in particular that you want to watch out for. The other thing is when you go to restaurants, look for your gluten-free menu, which generally is indicated by a GF. If that's on there, you always ask how it's prepared in your restaurant. If you go to a restaurant, you're comfortable with them, by all means, that's great. But if you're going for a first time, ask, because if they're using the same mixture or mixers, if they're using the same cutting boards, things like that, to prepare the food and they're not getting it fully clean, you can get cross-contamination with gluten, which can cause issues for you. But again, once you're comfortable with that place, they're probably doing it just fine, so watch out for that. There is also something to look at whenever you go to the grocery store is gluten-free flour, gluten-free chips even, which is great. We've found those ourselves personally, gluten-free crackers, and gluten-free pasta. Different way to cook with that, but yet it can be done and it is still very tasty. The good thing too with this is once you remove gluten from your diet, the villi within your small intestine will start to recover in 3 to 6 months if you continue to not consume gluten. In some people, depending on your body size, because if you're a bigger person, you got more surface area in that small intestine, as well as how much gluten and how sensitive to gluten you actually are, it can take longer to overcome than 6 months. But they will eventually grow back and be fully functional as long as you're staying away from gluten. Final tip is get to know a dietitian. They can help you out immensely with this disease, not only as far as what you need to do, but what you can and cannot eat, and tips to actually incorporate some of the good things that you like in your diet right now that you can't eat in a more healthy, gluten-free aspect.